Dr. Morris again. Appreciate you again viewing our videos and taking this the world of health on. And remember, we're talking top of the mountain stuff here. There's all levels of health that we discussed before, but I'm taking you all to the top of the mountain. And the top of the mountain is definitely going to be the fruitarian diet. So if you can ever move yourself up into that range, go slowly, but sometime get to the point where you're living on fruits for a few months or a year or something. But if you really want to dig into that lymph system, really hit those fruits. Now, I've got a video coming up online today or this weekend in regards to detoxification, the art and science, because detoxification is your golden key here. And this is going to be kind of a long video because there's a lot to tell you about detoxification. It's an art. There's not too many people in this world that have the ability to really detoxify you. Unfortunately, not saying that from ego, but if you take a look around, the people we get here, we get them from the Hippocrates, we get them from Dr. Cousins, we get them from these people that think vegetable matter is a great detoxifying tool, and it isn't. You will not go far in your detoxification on vegetable matter, and these people are into digestive enzymes, probiotics, and all the crap. And it's not going to turn your kidneys on. It's not going to get your adrenals moving any better. It's not going to do anything for you. So people are spending thousands of dollars here and not getting any remedy, and that's because it's the wrong way. And too many years down the road, for somehow I don't think these people studied all the greats, especially from the 1800s, early 1900s, all the physicians, all the fruitarian thinkers, all the people who really got success at regeneration of tissue, because that's my whole focus. And but this video today is going to be a question and answer video. I'm going to be gone for a couple of weeks, so I'm not going to be able to get back with you as I would like. So this might end up being a little bit of a long one, so I apologize for that. But I've got a lot of different subject matters here, and we shot this the other day, but unfortunately our camera wasn't turned right. So let me start going over some of your questions, and I hope I can answer them to suit you. And if not, call the clinic here, and we'll help you here. So let's start going over some of your questions here. And keep them coming, by the way. Be happy to make these question and answer videos as we go along here. It does give me a great opportunity to cover the subject matter. You're always going to see me go back to the lymphatic system. You're going to see me go back to the cells of the body, and you're going to see me always go back to acids. That's the corrosive side of chemistry. And understanding that, I get a little more detailed in detoxification, the art and science, and then the lymphatic video, and I have it on my website as well. And so learning how simple that is, you guys will be able to heal anything. There's nothing you can't cure out there. So realize that, and I think I've tried to make that quite evident on that detoxification video out there. We've seen some incredible things. One of these questions was a 13-year-old scoliosis case. We had a case of a quad. He was 57 years old, trampoline accident at 16 years old. C4, C5 quad does give you some upper movement, not much. Major scoliosis to the right. He fell out of his wheelchair and fractured his upper right femur, and it healed in a 28-degree angle, bulging his thigh and pulling his leg up 2 inches. In his 11th month on all raw and herbs, his spine pulled itself straight and the leg readjusted and pulled itself straight again. Now that one made Fox News. That was a pretty good case. But the power the body has to pull that spine back. I will tell you this though, you've got to make sure that you're utilizing calcium. You cannot take calcium. That's a wrong way to address this. This isn't about deficiencies. That concept is way down on the bottom of the mountain. You have to take another step here, and that step is, how does the body utilize nutrition? How does the body utilize calcium? You've got to take that one other step. And the utilization of a calcium is a parathyroid hormone. And that's important here in a nurse that asked me, she's a mental health nurse, and she asked me about mental health issues. When you don't utilize calcium, depression falls into this game here. And this, of course, the whole chakra or the thyroid area is your id, how you see yourself, how you feel about yourself, how much you like yourself or don't like yourself. But it also is calcium utilization. The thyroid does a lot more than just keep your body warm. And so the parathyroid, very important. And you mamas out there with this parathyroid weakness, the babies just suck calcium out of you guys, and that's where you get into the postpartum depressions. I think I mentioned on one of the videos Andrea Yates, which drowned 5 of her babies. And if you look at her, she's gaunt, very emaciated, and I can tell you, she was hallucinating, major postpartum depression. So what do medical doctors do? You give them antidepressants. That shows you they don't know a thing about what causes anything. And we got to get out of that kind of thinking if we're going to survive as a race on this planet. Now, you know, we're just bodies on this planet. Remember, you're a soul using your body right now, but it'd be nice to have a place to harbor the body that was halfway loving. So, 2 things take the calcium out of women, and one big thing out of men, and that is, 1, acidosis. When the body becomes acidic from your lymph system backing up. Now, when the lymph system backs up, that's kidney failure. And there was another question here about this young girl with kidneys. I've said this before, guys, on the video here. The younger you are, the more serious kidney problems you're going to have. You're going to see a lot more UTIs and cystitises and things like this. But this controls the whole gigantic lymph system, and this is all your cancers and everything. So you want to take herbs. I have 2 kidney formulas. I would do both kidney formulas. I would do 1 lymphatic formula, and I'd do a parasite formula just to get the fungus down. You can take antibiotics to heck freezes over, and you're going to make yourself worse. You're not after the bacteria. You're after the acids that's burning your kidneys and your bladder. These are acids, and your kidneys aren't filtering. Well, the adrenal glands on top control that. Remember, low blood pressure is weak adrenal glands. The systolic blood pressure number is your adrenal glands. Your diastolic is your kidneys. So when you have high blood pressure, you have kidney weakness. Fix the kidneys and the diastolic comes right down. You don't take, lost on high blood pressure medications all your life and never fix the kidneys, because you'll eventually lose them. And this is the problem with medical thinking. Focusing on the effect, that's not curative, that only hurts people, and not where we need to be in the 21st century here. So calcium, the body, think of this as a war between the 2 sides of chemistry. You've got the female base alkaline chemistry, which is the healing regenerative chemistry, basically, and then you've got the acid or corrosive side of chemistry. Yes, we don't like too strong of alkalis like lye and stuff. Yeah, it can burn. But basically, in simplistic talking, base chemistry is healing, acid is corrosive and breaks you down, causes pain and swelling. So, the body uses, remember, cholesterol is the body's main antacid. So this concept there's good or bad cholesterol, that freaks me out that we're still living in that kind of ignorance. You have to understand what cholesterol is. If someone says, well, your bad cholesterol's up, well, first shouldn't you understand what cholesterol is and what the role of it is in your body? I mean, that would be a smart thinking. And so it's an antacid, and it's all your adrenal steroids.